Hello, my name is Brandon Blanford. I will be discussing a problem that we need to fix in the healthcare system today. One of the problems that I think we should fix in the healthcare system today would be the fact that nurses are constantly understaffed. Um, for years, they've been extremely understaffed, and they are not the only ones that are being affected by this. The patients are meant to be our number one priority in the healthcare setting, but yet when nurses have to take care of 3 to 6 patients that are all equal acuity, it makes it hard, and some of these patients do not qualify for intensive care units. So we are having to take care of step-down patients from the ICU, and that just jeopardizes the care that these patients are going to get and receive by the nurses that have the 3 to 6 patients. When there's a high to nurse to patient ratio, it allows for errors to occur when assessing or administering medications to these patients. The change I would like to see in the year of 2020 would be that nurses have mandatory nurse to patient ratios. This has been implemented in California, and the article that discusses the mandatory nurse-to-patient ratio in California is called California's Nurse-to-Patient Ratio Law and Occupation Injury. It displays the evidence that after mandatory nurse-to-patient ratio were implemented, that the rate of injury in California compared to the United States decreased by 31.6%, which is a big change. I would like to talk to the nursing leaders about this problem, although I am sure they have been impacted also if they have ever worked as a bedside nurse, and they would understand the importance of this being changed. The topic of my speech would be the rates of errors in high nurse-to-patient assignments and patient mortality related to nursing workload. These are just a couple of the topics of my conversation that I would discuss with them. There would technically not be a change in the nursing role, but rather the quality of the care that the patients are receiving, which would increase, I believe, due to the nurses being able to spend more time in the patient's rooms rather than having to rush from one room to another, so that they ensure that they get all of it done in a timely manner. The type of nursing care delivery model that would be utilized to ensure this by 2020 would be a patient-centered care. Some of the activities that I would do to make sure that this was implemented by 2020 would be to mandate that all the nurses fill out like an acuity sheet to ensure that the patients are equally being discussed with the charge nurses, and also discussing the plans of care with the patient, setting goals with the patient so that we can ensure each day what needs to be done for each patient. Criteria for use to evaluate the effectiveness would be a survey. I would do a pre-survey for patients and nurses, and I would do a post-survey. I would ask the patients about the care that they think they've got. We've had like Press Ganey being utilized now, and after the fact, hopefully the Press Ganey scores will go up, and then also the nurses' pre and post survey will be able to tell whether they are enjoying the acuity or they think that we need to work differently by the year of 2020. These are just a couple of the things I would implement, and I do believe that we would see an impact directly on patient care. Thank you.